In this video, we are going to discuss about the right atrium. We can see the thoracic cavity over here. We have removed the anterior wall of the thoracic cavity so that we can identify the viscera better. In addition, we have reflected the anterior part of the right and left lungs also to see the heart more clearly. We can identify the sternocostal surface of heart over here. This is the right border of the heart, and this is the inferior border, and this is the left border of the heart. We can identify the apex of the heart over this area. Now we will focus on the right atrium, which is located over here. We can identify the color difference very easily. The right atrium, it is a quadrilateral chamber. It is situated behind and to the right side of right ventricle. This is the right ventricle, and the right atrium is located to the right side of it. And from the right ventricle, it is separated by the right part of atrioventricular groove. We can see the atrioventricular groove over here, which is filled by the epicardial fat. And right atrium forms part of the, we can see the sternocostal surface. It forms a part of sternocostal surface, and it forms the entire right border, which is clearly visualized from this view. When you look at the base, that is the area diametrically opposite to that of apex. This is the apex. So roughly the posterior surface that forms the base of the heart, and the right atrium will form around 1/3 of it. Now, when we look at the extent of the right atrium, it extends from the superior vena cava. This is the superior vena cava. It extends from the superior vena cava, and it extends till the opening of inferior vena cava. Inferior vena cava is not clearly visualized here. We will see that in the next diagrams. This particular point, that is the junction of superior vena cava and the right atrium, is roughly located behind right third costal cartilage, and the junction between inferior vena cava and the right atrium is located behind sixth right costal cartilage. Now, when we look at the external features in general, we can identify the right auricle over here. We can see that. It is a conical muscular projection, and it arises from the antero-superior part of the right atrium. This is the area, and this right auricle, it extends upwards and to the left side towards the ascending aorta. This is the ascending aorta. We can see the direction of the right auricle very clearly. Now, if you look from the right side, we can identify a shallow vertical groove which is not clearly visualized in this view, and that groove is known as sulcus terminalis. It runs along the right border of the heart, and it extends between the orifices of superior vena cava and inferior vena cava. This sulcus terminalis corresponds with the crista terminalis in the interior of right atrium. Now, we will see some relations. We are not able to see that clearly in this particular diagram, but we can assume the relations. In front, as I have already told, we have removed the anterior thoracic wall. So once we remove the anterior thoracic wall, we have the pericardium, pleura are there, and we have removed that. Then we have the anterior surface of the lungs are there, and that also we have reflected. So all of them form the anterior relations. Posteriorly, to the right side, we have right pair of pulmonary veins. To the left side, we have interatrial septum, because we are talking about the right atrium, which is over here. To the left side, obviously, it will be interatrial septum, which is separating it from the left atrium. Now, when we look at the lateral relationships, we can identify the pericardium, which was reflected over here. And on the surface of pericardium, we have right phrenic nerve and pericardiacophrenic vessels. We can see some vessels and the nerves over here. These are the pericardiacophrenic vessels, and this is the phrenic nerve. Now, further laterally, we can identify the mediastinal pleura. We can see the pleura over here. And further laterally, we have the impression on the lung, mediastinal surface of the right lung. That is the cardiac impression. And medially, the right atrium is immediately related to the roots of ascending aorta and pulmonary trunk. That is the area over here. This is the root of ascending aorta. This is the pulmonary trunk. Now we will see some other views to identify the positioning of the right atrium. This is the first view. We can identify the base of the heart over this diagram. This is the base of the heart, this much area. And this is the area of the base of the heart which is formed by the right atrium. And here will be the sulcus terminalis. This is another view of this particular right atrium. Now we will move on to see the interior of the right atrium. The interior of the atrium, if we have to see that, we can open the atrium in multiple ways. But classically, we cut through the area between superior vena cava and the opening of inferior vena cava, and we will reflect that part of the heart further anteriorly. So this is the reflected part of the right atrium, and we can identify a ridge over here, smooth ridge over here. That is the crista terminalis. When we look at the interior of the atrium, we can identify a posterior part which is comparatively smoother in appearance, and this part is known as sinus venerum, and there is an anterior part over here and here as well which is rough, and it is known as atrium proper. This atrium proper, as we have already identified, it includes the right auricle also. This is the right auricle. We can see the roughness in the interior of right auricle. And these two parts are separated by the smooth muscle ridge. We have already identified that this is the smooth muscle ridge separating between them, that is known as crista terminalis. When we look at the smooth part, the sinus venerum, it receives the opening of superior vena cava. Also, it receives the opening of inferior vena cava. And the sinus venerum, it developed from absorbed right horn of sinus venosus. The other area, the atrium proper, is derived from right half of primitive atrium. Now we will dig further. First we will see the sinus venerum. That is the smooth posterior part of right atrium. We can identify mainly 4 to 5 features over here. First one is opening of superior vena cava. This is that opening. This is the area of the opening of superior vena cava. It is situated in the upper and posterior part of the atrium, and you can see the direction. It is directed downwards and forwards. It conveys the venous blood from the upper part of the body, and this opening is not guarded by any valve. This is the next opening, that is the opening of inferior vena cava. When we look at the inferior vena cava, it is situated in the lower and posterior part of the atrium, and this opening is very close to the atrial septum. This is the atrial septal region, and this opening is present very close to it. It conveys venous blood from the lower part of the body. The inferior vena cava opening is guarded by a valve. You can see the valve over here. I will just zoom it out. This is the valve, and this valve is known as Eustachian valve. It is formed by the duplication of endocardium, and it also contains a few muscle fibers. It is rudimentary. Rarely it is absent also. This particular Eustachian valve, it is attached by its convex margin. This is the convex margin of the Eustachian valve, and it is attached by its convex margin towards the anterior wall of the opening. We can see the opening of inferior vena cava. This is the anterior part, and this convex part of the Eustachian valve is attached to the anterior part. And its concave free margin, that is this margin, it projects into the right atrium, and it presents right and left horns. We can identify the right horn over here. We can identify the left horn over here. The right horn is continuous with the lower end of crista terminalis, which we have cut and reflected at this particular area, and the left horn is continuous with the anterior limb of limbus fossa ovalis. This is the limbus fossa ovalis. This is the anterior limb of limbus fossa ovalis. We can identify the left horn is continuous with the anterior limb of limbus fossa ovalis. In fetal life, this valve regulates the flow of blood from inferior vena cava to the left atrium through the foramina vein. This valve is developed partly from right venous valve and partly from sinus septum. Now we will focus on the next opening. That opening is over here. This opening. It is the opening of coronary sinus. It is situated between the opening of inferior vena cava, that is over here, and the right atrioventricular orifice. This is the area of right atrioventricular orifice. So we can clearly identify the opening of coronary sinus is located between the opening of inferior vena cava and right atrioventricular orifice. It is guarded by, or it is guarded at its lower margin by an incomplete semilunar valve, semicircular valve, more precise. And this valve is known as Thebetian valve. You can see the Thebetian valve clearly in this area. It is developed from the lower part of right venous valve. Just above the opening of coronary sinus lies the atrioventricular node, which we will see it more clearly after 1 to 2 minutes. Next feature is the foramina venerum minimum. And these are minute openings of vena codis minimi, and they are more numerous in the septal wall. Anterior cardiac veins and sometimes the right marginal vein open in the atrium proper through the foramina venerum. And lastly, there is intravenous tubercle. And this intravenous tubercle is scarcely visible in man, and it is more prominent in quadruped animals. Okay, that's all regarding the sinus venerum. Now we will move towards the atrium proper. In the atrium proper, we have crista terminalis, musculae pectinati, and also part of the interatrial septum as well. First, we will see the crista terminalis. We can identify the crista terminalis clearly here. It is a smooth muscle ridge. You can see the cut end over the here, and you can see the cut end of crista terminalis over here. This smooth muscle ridge, it extends from the upper part of atrial septum because this is the area of starting point of crista terminalis. And at the starting area, it is lying in front of the opening of superior vena cava. This is the superior vena cava. You can see the positioning of the starting point of crista terminalis. After starting from this area, it skirts around the right side of the superior vena cava opening. You can see that. After passing through the right side, it runs downwards along the right wall of the atrium, coinciding externally with the sulcus terminalis, which we have seen in the beginning. It ends below by joining. We have already told that it joins with the right horn of valve of inferior vena cava. The crista terminalis is a remnant of the upper part of the right venous valve. The next feature here is musculae pectinati. And these are parallel muscular ridges, and they pass forwards from the crista towards the right atrioventricular orifice. We can see the direction of musculae pectinati over here. It starts from the crista and it passes towards the atrioventricular orifice. Some muscle fibers form a network in the interior of right auricle as well. Right auricular appendage is a potential site. This is the area, and it is a potential site for the formation of thrombi, which if dislodged, it can result in pulmonary embolism. Now we will conclude our findings with the septum, interatrial septum. We will discuss only about the right side of interatrial septum, that is this area. We can identify the fossa ovalis, this particular region. The fossa ovalis is an oval depression above and to the left of opening of inferior vena cava. This is the inferior vena cava. You can see the relation. It is present above and to the left. The floor of the fossa is thin and it is developed from the septum primum. Now the second feature, evident feature, is the limbus fossa ovalis, or it is also known as annulus ovalis. You can see the limbus. It is a sickle-shaped sharp margin which surrounds the upper, that is this area, the anterior, that is this area, and posterior, that is this area, margins of the fossa ovalis. The anterior limb of limbus, it is continuous with the left horn of the valve of inferior vena cava. We have mentioned that earlier. The limbus is developed from the lower free margin of septum secundum. The third feature is triangle of Koch. It is a triangular area, so it should have three boundaries. It is bounded in front by the base of the septal leaflet of tricuspid valve. This is the base of the septal leaflet. Behind by the anteromedial margin of opening of coronary sinus, that is roughly this area, roughly. And above by the tendon of Todaro, that is not clearly visible, but roughly this is the area of tendon of Todaro. And tendon of Todaro, it is a subendocardial ridge extending from the central fibrous body, roughly from here, to the left horn of valve of inferior vena cava. Roughly around this area is the presence of tendon of Todaro. And these three boundaries together bound the triangle of Koch. The AV node, atrioventricular node, lodges in this triangle, and ventrocaudal to the node lies membranous part of ventricular septum. You can see the membranous part over here. And next feature we can see in the interior of right atrium is torus aorticus. Torus aorticus is nothing but an elevation in the antero-superior part of the septum, roughly over this area, and it is produced by the right posterior aortic sinus. This is the ascending aorta. At the base of the aortic sinus, ascending aorta, we have right posterior aortic sinus, which is the non-coronary sinus, and that is producing torus aorticus. And finally, when you look at the interior, we can clearly see the atrium proper is communicating with the right ventricle through this opening. And this opening is known as right atrioventricular orifice. This opening is oval in shape and it permits the tips of three fingers and guarded by tricuspid valve. This area of the right atrium is known as vestibule of the tricuspid valve. The plane of the orifice is almost vertical so that blood flows almost horizontally. We can see the plane of the valve. So when the blood is flowing from right atrium to the right ventricle, it flows almost horizontally. And finally, we will summarize the development of sources of right atrium. Sinus venerum, which is the smooth part, is developed from absorbed right horn of sinus venosus. Atrium proper, that is the rough part, it is developed from right part of primitive atrium. Crista terminalis is a remnant of upper part of the right venous valve. Valves of inferior vena cava and coronary sinus are derived from the lower part of the right venous valve. The floor of the fossa ovalis is formed by septum primum, and the limbus fossa ovalis is a remnant of lower margin of the septum secundum. With that, we complete the major points regarding the right atrium. Thank you for your patient listening.